It's a great pleasure for me to present the previous edition of the EGEA conference. As you all know, EGEA started quite some time ago. In 2003, we started with a very ambitious plan of establishing a series of conferences that would offer a common place for colleagues coming from different disciplines of research, of public health, and also of policy and implementation. We were very fortunate to receive support from the European Commission, and I'd like particularly to thank the DG Agri and DG Santé for their continuous support to the EGEA activities. And we were also very pleased to be hosted directly by the European Commission in the meetings that we organized in Brussels in 2007 and 2010. So altogether, this has been a long and a very fruitful experience of meetings with excellent participation and very, let's say, productive outcomes over the years. The 2018 EGEA conference took place in Lyon, and I can't prevent myself from saying that was the great time when we could meet in person and enjoy not only the science, but also the personal interaction. The Lyon meeting was part of the European program called Fruit and Vegetable for Health, and with a very specific target of stimulating the active participation of health professionals and general practitioners in the field of diet and health promotion. In fact, health professionals are best placed for positively influencing healthy behavior, and including a improvement and improved diet and improved food choices. And the focus of the 2018 conference was, similarly to other conferences we organized, how to go from science to practice, which is a very ambitious target. Because first of all, we need to summarize what science, and then have a common agreement, and then a discussion on how to translate into practice. So that was the cover page of the meeting, the 2018 meeting, and we were very pleased that the conference received formal accreditation from the European Accreditation Council for Continuing Medical Education, and received support and very active participation from the University of Lyon. The conference included keynote lectures and parallel sessions, and I will come back to this later on, poster presentations, and we were very lucky to have very active debates from all participants, as well as from organized panel discussion, and was attended by over 50 international speakers, representing very different sectors of medicine, research, in the European Commission, international organizations, particularly WHO and the OECD, and a number of representatives of political life and industrial sector. The session was, the entire conference was structured with two parallel lines. One was focused on children, and the other one on adults. And children was quite new for us, because we had previously essentially focused on adult diet. And we had a number of excellent colleagues with a lot of experience who shared their research on how diet starting from pregnancy and from the initial complementary feeding can influence health, but in particular can influence what is called the chemosensory experience of children. So children get used to taste that they will like and they will like for life, and how a diet rich in fruit and vegetables in early months of their life is important. In parallel, we looked at, other colleagues looked at the effect of diet in adults with a specific focus on prevention of chronic diseases. And we had a very innovative session on diet, fruit and vegetables, and their potential impact on mental health, with finally a convergence on how to prevent undesirable weight gain and the major role that fruit and vegetables can have in helping in having a balanced diet with appropriate energy intake. All these two lines finally converged into how food system, food marketing can be modulated to improve food choices toward a healthier diet, and how the general practitioner and in general the health sector can have a positive impact on health promotion and healthy diet. We were very lucky at the end to close this EGEA meeting with the participation of members from the European Parliament, from OECD, from the European Commission, and particularly from Santé, in the fruit and vegetable sector, and other colleagues from different sectors of the European Union. As I said, we were lucky to have over 300 participants from 30 countries, from different sectors of the society, and to receive support from and active participation from a number of very prestigious organizations and sectors of the society. One particularly active component of the EGEA 2018 was the abstract session. We received quite a lot of abstracts and many of very high quality. And at the end, we wanted to give one prize. We gave 3 prizes because we really had excellent abstracts. One was focused on the impact of fruits and vegetables vouchers to promote fruit and vegetable consumption among children in low-income families. Another one focused on how one can trigger fruit and vegetable consumptions in young adults. And the third one was focused on how physical activity could be modulated in a negative sense, unfortunately, by the time young people spend on particularly children sitting in front of the screen. So that is a very pertinent research in this time of sitting, of being, let's say, for societal changes and also for contingent difficulties, being forced to spending more time indoor. So at the end of the conference unanimously adopted a number of conclusions, which you can see here in the final screen. One is the agreement that scientific evidence is very strong, indicating that it's time to take action. Another area is the importance of general practitioners and health professionals in general in promoting health and in promoting a healthy diet. We stressed the importance of school and the school environment to induce positively the choice of a healthy diet and the concept of eating well in children and young and teenagers. Finally, we touch on how the food system should be, let's say, improved for being, let's say, positive both for people and for the planet. Often we live in a society where the environment and the individual well-being are seen as being in contradiction. And the meeting came up with a number of recommendations on how this should actually, we should actually think at a healthy diet in a healthy planet. And there was a final conclusion that it's unlikely that things will improve unless there is a convergence of efforts from the general population, from the experts, from the agricultural, industrial sector, from the science and the public health sector in general. So to say final word, it was an extremely productive meeting, and obviously I look for this meeting to be as productive as well. Thank you for your attention.